Hi, good morning, everyone. We are here from Health Docs and in partnership with QRC, presenting on how to build organizational resilience. Team, you can hear me, right?
Yeah, we can hear you.
Okay, so we have partnered recently with QRC. Health Docs develops solutions for GRC and also works on accreditation and certification implementation in partnership with QRC for the certification side. We also have been doing staff augmentation and AI analytical services and similar roles on the QRC side. They have a long history with the accreditation and certification side. Okay, we can move on to introducing the authors, so speakers. We have 3 panelists and they have experience in healthcare, aerospace and software. They have a wide background. So here we have Rupa Nagendra. She comes with a wide experience in healthcare, aerospace and software development. And she's a risk advisor. She's working in Health Docs for the past several years as a program manager, and also has the ISO certification, the 27001 certification, and has the Six Sigma black belt, and so on. There are a series of certifications associated. So as you see, there are the next panelist is Venkata Balareddy, and he's from QRC Solutions. He actually has been with QRC for a long time with a varied experience in the standards and the regulations. As you see, all the certifications associated. So especially the PCI DSS and the ISO side. So and he's a Six Sigma Yellow Belt. So our next panelist and speaker is Mohan Ramanujan, who is a freelancer and he has 30 plus years of experience in the implementation of management systems, and also has a rich background in all the standards. You see all the standards of ISO and NIST and HIPAA professional and a Six Sigma black belt certified, with experience in several companies listed here. So we will start through our topic.
Thank you, Harita. Thank you for introducing the speakers. Good morning or good afternoon to all, wherever you are. And today we are going to talk about this topic, so organization resilience on the standards, an overview of the standards. So you all might be, most of you might have heard about this recent headlines on various enforcement actions and penalties about this quality issues or the HIPAA data breach issues. So I have few cases listed here. There are I mean, almost I could not list everything here because of the limitation of the slides, but I just took 3 cases here just to set the context for the webinar. So one of the case, the first case I'm going to talk about is this. One of the healthcare provider has experienced a data breach which exposed almost 200,000 patient record. You know what was the result? They ended up paying 1.5 million in HIPAA fines. Not only it stopped there, but millions more in their reputational damage. So they could have been prevented this with the proper implementation of SOC 2 controls. If SOC 2 controls were in place, then they could have prevented this. So this was one of the recent headline what I came across. And the other one which grabbed my attention was this cloud-based healthcare IT vendor as hit with a ransom attack. So you know what was the total cost involved? not only this 1.5 millions of fine for breach recovery, but there are fines, downtime, and they lost the patient revenue also. So how they could have at least mitigated this risk is if they would have properly implemented relevant NIST 853 controls, then they would have got saved with this. So there is one more which is a highly grabbed attention from the from many of us is this medical device manufacturer. This is quite a repetitive issue in many medical device manufacturer side, that product recalls because of the faulty equipment, mainly because of poor quality of those equipment. The result is 10 million, not only 10 million, but there were product recalls, lawsuits. They have to undergo a lot of regulatory fines and face lawsuits. So these are all could have been avoided if they would have had a proper standardized procedure or process reviews, or I would say if they would have properly practiced and implemented proactively the right standard of ISO 9001 in a real spirit, then this could have been prevented or at least mitigated. So with this context, I would like to say the compliance with these key industry standards like SOC 2, NIST 853, or even ISO 9001, it's not just a best practice, but it is necessity for us to practice so that these fines, other things could have been avoided, and we would have had a good reputation for the organization. So with this a context, I would request my colleague, Mr. Mohan, to take over from here and talk about the topics. Over to
Thanks,
you.
Rupa. Yeah, sure. Thanks. Thanks a lot. And good morning, good afternoon, everyone. So in line with the context, it's already explained by Rupa. I'm going to talk about some of the standards, and my other colleague also is going to talk about it. So we will cover so primarily the importance of standards and regulations, and we will touch upon few standards and regulations here for your reference. Okay. So in line with the slide which you saw in the the ransom attack, then penalties, and so on and so forth. So how it is relevant for us, in terms of understanding the standards or regulations. So that comes to our mind. The standard will, as already mentioned by Rupa. So standards basically they are nothing but in a simple term, a collection of best practices collected over a period of time and also across the globe. Now, in other words, if there are some industry which is already practicing some best practices in one corner of the world, it's been collected and then it's being used by another corner of the world. So that way we know that there are industry standards which we can use, understand and implement so that we can prevent those incidents which you saw in the earlier slide. So standards is primarily both standards as well as regulations. They establish some kind of a benchmark in terms of what practice or what process you need to follow so that you achieve consistency. You meet applicable requirements and customer expectations. And by adhering to the standards, you also reduce risks, prevent accidents. You also protect users and the employees. And it also will help you to achieve compatibility across different regions, because you're following a uniform standard across the globe. So the moment you say you're certified for a particular, let's say, a particular standard ISO 9000 or any other standard for that matter, so you will know the other industry, the customer organization will understand very well. Okay, so where we stand with respect to the practices. So that way it will help you to achieve interoperability and also compatibility. And it'll also help you to demonstrate, commitment to professionalism and achieve the goals whatever you want to achieve. And one more thing is, you also by implementing standards, you will have your own standardized process. So it'll help you to achieve consistency, reduce redundancy, and operational efficiency, and so on and so forth. Okay, and it'll also help you to meet legal requirements, avoid penalties, and it helps you to build trust with customers and stakeholders, and protect. Also, it'll help you to protect customer rights and data. Okay. So with that, talk about importance of standards and regulations. Now we will get into different categories of standards. So we'll start with ISO. ISO basically is an agency which is called as an International Organizational Standardization, headquartered in Geneva, Switzerland, started in 1947. So I think if you look at the number of standards which they have published is I think to the tune of 23 or 24,000 standards have been published already, covering various aspects of quality, safety, security, and so on and so forth. Okay. The ISO standards primarily they have built-in what is known as a Deming cycle, that is plan, do, check, act, PDCA. It's also called as PDCA cycle, which is called as Deming cycle, which is based on the continual improvement concept. So basically, you plan for improvement, do the improvement, check whether it is working or not, act. So basically, if it is working well, continue, otherwise change it. So it's a continual improvement model. So all ISO standards are based on this PDCA cycle. And they are ISO standards are internationally recognized, and it can be applied to any type, any size, or any type of industry. Many standards are there. They are generic in nature. It can be implemented by various industries. It could be healthcare, it could be retail, banking, and so on and so forth. Any type of industry. There are a few standards which is specific to some industry, but barring that, mostly they are generic in nature. And to name few standards, ISO standards. So there's a standard called ISO 9001, which is for quality. 27,000 InfoSec. And there are other standards like 14,001 for environment, 45,000 for health and safety, so on and so forth. There are so many. There are different standard series are there. They're all focusing on specific areas. So it will help you to implement those best practices in those areas and then achieve your specific goals. So usually they follow certain structure. All these standards, they follow a common structure so that if you can just go back to the previous slide, thank you. Yeah, okay. So they follow common structure so that if you want to implement multiple standards, it becomes easier for you. So you can have your own integrated management system rather than focusing on only one area. So any organization will have multiple aspects. So you want to achieve quality goals, you want to achieve security goals, you want to achieve safety goals. All that can be achieved if you want to implement multiple standards. It becomes easier. So that is it has been structured. So as I already mentioned, there are various standards which covers various areas, and it will help you to once you implement it and you can get certified by third-party certifying agencies, and so the certification will help you demonstrate your compliance and commitment to the best practices. It enhances customer confidence, ensure regulatory compliance, improve efficiency, and it also gives you competitive advantage. So you can bid for a better business process. Okay. Yeah. Now going to the next standard, which is NIST. So NIST basically is an agency of U.S. Department of Commerce. So it is basically focusing on promoting innovation and industrial competitiveness. So they also NIST also develops standards which can be used and implemented by various organizations. Okay. So one such standard is 853, NIST 853, which is related to information security and privacy risk, managing information security and privacy risks. So it gives a detailed catalog of privacy and security controls which you can implement in your organization. Yeah, go to the next slide, please. Yeah, there is another standard which is called as CSF, Cyber Security Framework, which is similar to 853, but here it's focusing primarily on cyber security. Yeah, so it helps you to improve security, better compliance, stronger risk management, consistency in cyber security, and improved response time. So these are some of the advantages of implementing these standards. Okay. Yeah. Next. Yeah, as I already mentioned, cybersecurity is a framework. It's a voluntary set of guidelines, and also it cannot be also called a standard. So best practices which helps you to manage and mitigate cybersecurity risks. So it gives a very flexible structure so that it can be tailored to a specific organizational needs, and also depending on the sector where you're implementing it. So it has 5 core functions: identify, protect, detect, respond, and recover. So here, so basically it is representing life cycle for managing your risk, which involves, in case of any cybersecurity incidents, how you manage it, including identify, how you're protecting it, how you're detecting if there is a if there's an incident, and respond and recover. So these phases are given in detail, as to how you would prepare your organization, in case an incident occurs. Yeah. So basically, that is what it is focusing on. Okay. So both this CISF as well as 853, they are having a lot of overlapping processes, and they can be mapped to each other. So in other words, if you take these two standards together and you can implement it, so your risk management will be much robust, and then in terms of security, you would have certainly you'll be able to achieve your security goals. Yeah, yeah, that's it. So now we have a poll now, so you can just participate in the poll. Request you to participate in the
Anita,
poll,
can you
please.
please? There will be a quick poll.
Yeah, can you please go ahead and fill? Okay, we got a response. 80% are aware. That's good. So 20% are not aware if their particular organization is certified. So we will provide insight into why. Okay, cool. Thank you.
Great. Hi, everyone. My name is Venkat. Thanks to Harita, Rupa, and Mohan for the introduction and giving a brief on the standards. So I will be briefing regarding PCI DSS, Payment Card Industry Data Security Standards. So um, wherever we use or credit cards or debit cards are being used, this payment card industry data security standards come into place. So it is a amalgamation of major card brands who has come up with this standard to implement the best practices when it comes to the credit card data and other things. So there are many breaches and which happens when it comes to the card data. So there are POS intrusions, web application attacks, issues of privileges, physical threat, physical theft, skimming of cards, various type of malware, uh, cybercrime, various type of attack scenarios where the card data cannot be accessed or the pages cannot be accessed. So these are the various occurrences normally when it comes to the card breaches. So when it comes to the percentage, so around 26%. So we'll go to the next slide. So yeah, around 28% of the breaches happens due to weak or remote access security. 28% of the breaches happens due to the weak passwords. 15% of the breaches happens because of the lack of appropriate validations, input validations. 15% of the breaches happen due to unpatched systems, 8% due to the misconfiguration of the systems, and 6% due to the various malicious insider activity which happens. So sorry for that. PCI DSS is a global standard which is applicable to all the merchants, financial institutions, service providers who either accept, process, store, or transmit the card data. So there are various levels, 4 levels, which have been categorized based on the volume of the transactions which the merchants or the service providers handles. So based on the levels, there are various controls which they have to be implemented, and certifications like level 1 certification, which requires a AOC and the ROC, and the other levels where self-assessment questionnaires will be there that needs to be followed. Failure to comply, like any other things, leads to various fines, and there is a reputational loss to the organization. So when it comes to the requirements, there are 6 control objectives which are divided into 12 requirements. We'll go to the next slide. So secure network and systems is the control objective, where installing and maintaining a proper network security controls, which includes implementing the firewall, segregating the systems into various zones, like restricting the traffic based on the requirements. These are all the network related security controls which needs to be maintained. From the system perspective, all the systems and the network devices are to be appropriately configured, patched, and other things. So these are the things which comes from the system and network security controls. Then it comes to the protection of account data. So all the card data which is available either in the form of track data, or which is which we can see on the card. So this needs to be protected either through encryption or hashing or truncation. So that is all about the protection of the card data. And then whenever it is in the transmission mode, so that needs to be properly protected by encryption, either through a HTTPS, which TLS 1.3 and above, or a proper end-to-end VLAN should be available to protect the card data in transmission. So when it comes to the vulnerability management program, so protect all the systems and networks from malicious software. A proper anti-malicious software, antivirus needs to be deployed in all the systems. And then appropriately, all the applications are to be hardened right from the development stage to the production. So that is what is dealt in vulnerability management program. When it comes to access controls, how appropriate access is to be provided to the systems on a need-to-know basis, how these accesses are to be protected with proper passwords, multi-factor authentication. So all these are taken care in the access control measures, and a proper physical security measures are to be adopted. So this is all being dealt in the access control measures when it comes to the requirement till 9. And then it comes to the monitoring and testing of the networks. So appropriate logging and monitoring is to be adopted, and then all the logs are to be properly analyzed with a SIM solution. So these logs are to be correlated, and appropriate alerts are to be generated, and these alerts are to be properly analyzed. If any incidents occurs, immediately it should be highlighted and appropriate action needs to be initiated. When it comes to the requirement level, proper testing needs to be done. When it comes to the internal IPs, all the internal vulnerability assessment is to be conducted. External IPs, proper ASV scanning needs to be conducted, and then internal penetration testing and the external penetration testing for the application needs to be conducted. And then entire ambit, again, it forms under the information security governance. So proper governance framework should be available for the entire security, with proper information security policies. Wherever human are involved, appropriate background checks, risk assessment needs to be conducted. So these are all the things which is been taken care as part of the standard. So once these are implemented, there is a appropriate certification if you can do, then that will help you in implementing, and the protection of the data can be ensured. And then if any breaches also happens, you will be assured that only a minimum level of risk is there to the data. So this is all about PCI DSS. We'll go to the next one. Sorry for that. So when it comes to the service organization controls, there are three SOC controls which are there. SOC 1, SOC 2, SOC 3. SOC 1 deals about the financial data, wherever our balance sheets, profit and loss statements, anything related to the invoices or paychecks, anything related to the financial data, that is SOC 1. Anything related to the services which fall under the security 5 trusted principles: security, availability, confidentiality, process integrity, and privacy. So this is being dealt in SOC 2, and then whenever the reports are to be published, then it falls under the SOC 3. So most of the organizations go for SOC 2 type 2 assessments. So type 1 is related to the design related controls, whereas type 2 it falls under the operational effectiveness of over a period of time. Maybe it may be 3 months, 6 months, or a year. So 5 trusted principles and type 1, type 2. Normally SOC 2 type 2 is the assessments which are conducted. QRC is one assessing organization which we are certified as a CPA in Wilmington, Delaware, and we certify for SOC 2 type 2. So most of the organizations, either it is a cloud service provider, SaaS application provider, healthcare providers, any of the IT outsourcing organizations, or any of the third parties, they require SOC 2 type 2 assessments. We'll go to the next slide. Yeah, we'll go to the poll.
Have a quick poll.
Yeah, so were there any security incidents in your organization in the past year? If you don't want to, you can just say not aware also, if you didn't want to really reveal anything. 100% said no. That's good. Didn't you have CrowdStrike attack? You got lucky. Okay, I'll close the poll. Okay.
Thank you, Harita.
Thank you.
Yeah. Okay. So there is another standard which is say developed by DNV. DNV is actually a certifying agency which does a lot of certification, accreditations, testing, and other things. They also have developed their own standard called DNV Healthcare Standard. This is you can say it is more of a combination of ISO 9001 as applied to healthcare industry. You can say hospitals basically. So it gives a lot of best practice guidelines and standards, how you can implement quality standard in hospitals. So you can also, of course, go directly with ISO 9001, but this helps you to interpret better as applied to healthcare areas. So the benefits, some of the benefits could be quality of your services, healthcare, and with increased management confidence, and do your improvement, continual improvement, because as you know, I already mentioned earlier that improvement is promoted by the ISO standards, and of course satisfaction, motivation, all these are various benefits which you will get. So to simply put, it is nothing but the ISO 9000 standard applied for healthcare industry. Yeah. Thank you. Okay. When it comes to regulations, so see, the major difference between standards and regulations is something like this. Standards, you have option, in the sense most of them are voluntary in nature. You can decide, as to which standard is relevant for you, you want to implement. If you can also choose not to implement any standard. That is possible, unless there is a mandate by your customer or any other stakeholders. Whereas regulations are not like this. They are also kind of framework given set of rules, but they are mandatory in nature. If your organization fall in the category of of the organization where you have to implement it, so in such situations, obviously, it will become mandatory for you. So one such standard is HIPAA in US. So basically, this stands for Health Insurance Portability and Accountability Act of 1996, which was enacted by US Congress and signed by President Clinton. Okay. This is primarily designed to protect sensitive patient health information. Okay. It covers both security as well as privacy. Okay. So it applies to what is known as covered entity, so such as healthcare providers or health plans or clearing houses. They are primary covered entities, but also it applies to their associates. Who is a vendor who is providing service on behalf of those covered entities. So they are also come under this, and some of the aspects of HIPAA is something like this. Patients will have right to access their health records, and if they want, they can request for corrections or control how the health information is being shared. Okay, it must be, and there are controls which is given in this standard, which organizations have to implement. So they are called, safeguards, administrative safeguard, physical safeguards, technical safeguards. So there are various safeguards need to be implemented in order to be in compliance with HIPAA. And it also is expected that the organization have to do regular risk assessments, train the employees, and establish the policies and implement those things to protect PH. Yeah, next slide, please. As I said, HIPAA is a regulation. It's not a standard. It's a regulation. In other words, if there is a non-compliance, then it can lead to penalties. So you can see on the slide. So it can lead to 100 to 50,000 per violation. It can go to even up to 1.5 million. So depending on the type of breach or non-compliance which is there. And HIPAA has three kinds of rules: privacy rules, security rule, and the breach notification rule. So each has its own set of expectations. You have to implement those rules depending on your relevance for your organization. How you are, supposing you are a business associate, you're not dealing with any privacy data, so then maybe some rules may not be applicable. So depending on your organization entity, then we have to see what is applicable, what is not applicable. Whatever is applicable, you have to implement those things. Yeah. Thank you.
Okay, so we have a third poll. Is your organization compliant with HIPAA? Okay, that's a great answer. So we have sharing the results 100%. Yeah, I think that was expected. Thank you. Good, you're aware of it. Okay, we can continue.
Okay. Whether you are implementing a standard, an international standard, or some regulation specific to your region or whatever it is, there are a few set of things which you can generic steps, for your implementation. So it includes conducting a gap analysis vis-a-vis the specific standard or regulation, understand the gaps, and then setting up your teams so that they can work on closure of those gaps, so that you can achieve compliance. So as part of this, you will develop your process framework, which will help you to implement those standards, define the standards processes, and you train people, implement those processes which is already defined, and do a regular audits and monitoring. These are the common steps which you can think of when you are implementing any standard or any regulation for that matter. Yeah. Good. Thank you.
So now we want to tie in on how health docs and QRC can benefit you with everything that you saw today on the standards and the regulations and the solutions that we offer. So Rupa initially covered on the penalties in the order of millions of dollars with data breaches and quality issues and any faulty equipment and so on. So Health Docs provides GRC products and solutions, which are the governance, risk, and compliance products, varying from policies and procedures to risk and incident management and quality and so on. And we also have AI analytical services where we look at the incident and the risk data of the organization and try to figure out which are the high risk incidents that might be occurring or high risk categories, so that the organization can prioritize. Since if you run into thousands of incidents, you might have to prioritize on which one would be the highest risk, mitigate that first, and then work through your rest of the risk categories. So AI provides a deep insight into that. We also have Power BI and other staff augmentation that helps with resourcing additional resources to the organization. So accreditation and certification consulting is where we have QRC doing the certification side of things, and we handle the implementation for those areas. So if you can realize now that with the ISOs, HIPAAs, and other standards, it only keeps improving your organization's resilience. Thank you. And now we are at the Q&A session. So if you have any questions, you can type it in the chat window. Do we have any questions? Seems like. Okay, so yeah, the chat window is empty. We don't have any questions. Thank you all for joining. We will see you on our next webinar, or you can contact us for any questions that you have or any help needed.
Thank you. Thanks, everyone.
Thank you, team.
Thank you. Thank you. Thanks.
Bye-bye.
Everyone.